Welcome to this Learn at Work webinar presented by the journal Work, a journal of prevention, assessment, and rehabilitation, published by iOS Press. I'm Karen Jacobs, the founding editor of Work, and I'm delighted to be the moderator today on this very interesting webinar. I'm going to turn the webinar now over to Joanna, who's going to present on an article that she published in Work. And Joanna's in Poland, so welcome.
Hi, hello everybody. I hope everything is good with my voice. Yes, it works good.
Your voice is great. Okay. And I'm turning over to you.
Okay, so well, I'm a medical doctor. I'm a dentist, and I'm also a researcher. I'm a professor in School of Public Health in Medical University of Silesia. It is one of the biggest university in Poland, medical university, of course. And I'm head of public health department. And I did some time ago, I did a big project with my colleagues about a dental sector in Poland, of course, comparing to other countries, European countries, Australia, United States, of course, and some others. So after this project, we published few papers, and also this one about job satisfaction among dentists. So maybe I will start. Karen, we can change the slides, or because I cannot do it.
Look at the bottom of your screen. There'll be an arrow, and you should be able to press to advance. I can't advance it. You have the control now. Or use your arrows on. You do see an arrow key if you scroll around?
Yeah, because it was possible. It was possible, but now it is not possible. I don't know why.
Oh, it will. Let's try it. Let's keep trying. Just keep looking, and it's there to advance it. It's just a little something on the bottom of the screen.
So maybe I will continue.
Can you? Yeah, because I can't advance your slides. So if you can just try one more time, I think it'll be good for us to have you advance your slides. Do you see anything that can that you can use?
Well, I don't know.
There's little arrows on the bottom. Do you see anything?
No.
Just you scroll around.
Well.
Go to the bottom. Go to the bottom. And look at the left. Go to the bottom left and see if you see anything there.
Yeah.
You can do it this way then, if that's easier for you. Just keep, clicking on each slide.
Maybe it works now or not?
It's not in a presentation mode, but keep doing it this way. That it's better to just. Okay, great, thank you.
Okay, so here's our photo of me and my colleague, and well, it's this presentation schedule, but well, let's go to the paper. Job satisfaction is, well, one of the most important element in effective human resource management, especially among medical professions. They are exposed to negative effects of numerous risk factors which affect their health. And now I would like to, well, there are many definitions of job satisfaction, of course, in contemporary psychology. And here we put one of the definitions that job satisfaction is a state of positive or negative feelings that refer to a worker's professional duties, which result in his or her attitude towards work. Of course, satisfaction can be positive if the employee is satisfied with entrust tasks and working conditions, or negative if the job does not meet his or her expectations. So, as I said before, medical professions, doctors maybe, they are particularly exposed to many negative factors. And well, why? First of all, they meet enormous expectations of patients, of society, because these jobs realize social mission. On the other side, they have their own professional aspirations. And finally, many limitations. Well, first of all, physical, then organizational, financial, legal, technical, educational, limitation of competence. So this is really very stressful situation for them each day. And this profession of dental practitioner especially, is recognized as a tremendous prestigious and provide two very important values like good income and work safety. But on the other hand, dentistry has been associated with one of the most stressful work environments. And well, in this aspect, I would like also to highlight that it is very important to provide some knowledge, some scientific results of modifiable work environment factors related to job stress, because we should do everything to provide better work conditions for dentists and other medical professions, because it will result in a higher quality of treatment for the patients, so finally for us. Of course, there are many studies which show quite contradictory results regarding professional satisfaction, because some studies indicate very high level of job satisfaction. Others show moderate or low job satisfaction. Well, dentists are also professional group at a risk of burnout, and it is also very important to remind that dentists, it is a very special group of medical professionals prone to musculoskeletal pain and disorders. Well, in this context of this all results and this knowledge, it is important to consider if the profession of dentist can be described still as a dream job, as it was in 60s, in 70s, even 80s. Well, when I speak now with my young students, they still believe that yes. When I speak with my a little bit older colleagues, well, I don't see it as very, dream job. Well, but the aim of our study was to determine the job satisfaction among dentists and determine the factors which are related to. And we choose the relationship between perceived work satisfaction and age, gender, working time, income, office location as well, private or public sector, types of medical practice settings. In this research, we included 610 dentists representing different types of medical practice settings. I mean, solo practices, group practices, and medical facilities. All institutions, all offices were selected randomly, and we used a special structured questionnaire. We conducted the study employing personal interview technique. And the questions, of course, included a four-step scale reflecting the job satisfaction. Then we did, of course, all necessary statistical analysis. And here it's also important that we took into consideration different locations. I mean, rural municipalities, small towns, cities of medium size, and large cities. And here in these two slides, I put all statistic analysis we did. Our colleague did this job. So let me go further to the results. We were impressed by the results because, first of all, more than 90% of our respondents declared rather high satisfaction with their profession. Well, it was 34 almost of dentists reported their satisfaction as good, 60% rather good, and only 6% of respondents reported a lack of satisfaction. So we were really impressed. We found our research confirmed relationship between job satisfaction and age, sex, location of the office, and working in public or private sector. So these professionals who run the clinics in small towns were 4 times more likely to be dissatisfied than doctors working in large cities. Our research also confirmed that there were more dissatisfied doctors who ran their clinics in small towns than doctors working in rural areas and in medium-sized cities. What about correlation between job satisfaction and sex? So women were slightly more satisfied with their work than men, 95% to 91%. We found also significant association between age and job satisfaction. And what was important, the feeling of dissatisfaction increased with the age, because the group with the lowest level of satisfaction was represented by the oldest group of people who were over 60 years of age. And here is the diagram which shows the relation between the age of doctors and the level of satisfaction. So this group of the oldest people you see on the right, it changed significantly comparing to the younger groups. So our research also confirmed that the working to private or public sector is also very important, because we found significant statistical relation between job satisfaction and the form of financing of dental services. You know, we in our country, a dentist can, it's of course it's voluntary, and they can have a special contract with National Health Fund, and of course this dentist must accept all conditions of National Health Fund. Well, I think that we can compare the conditions with National Health Service in Great Britain, because public and private sector in Poland is completely separated. So dental dentist can work for National Health Fund and also for private patients, but they must separate the services. So dentists who do not have these contracts and don't work for National Health Fund, they work in private sector, were much more satisfied with their work, 41% to 26% of dentists which work for the public sector. And this our study also showed the relation between working time, working hours, and job satisfaction. And we found that job satisfaction was higher among doctors who work more, who work longer. Well, we presented, you know, the job satisfaction, the relation between job satisfaction and location of the office, and the work for public sector or for private patients, and relation between job satisfaction and gender in this table. So well, we can compare some groups, and well, it's the same as I mentioned before. And well, we tried to check also the relation between the job satisfaction and income, and the job satisfaction and dental practice settings. As I told you before, it means there were three groups: the solo practices, group practices, and medical facilities. and we didn't find a significant relationship between job satisfaction of dentists and dental practice settings or income. Well, for us, it was maybe a little bit mysterious, no relation between job satisfaction and income level. And in the end of our questionnaire, we asked our respondents to assess the dental sector in Poland because, during over past 20 years, our politicians implemented plenty of reforms in our health system and also dental sector. So we wanted, and I think that no dentist and no patients are satisfied of these reforms. And we assess as a researcher our dental sector as very ineffective. On the other side, it's very ineffective. I mean health outcomes. I mean periodontal disease. I mean caries, especially among children and adolescents. On the other side, we have a very high level of human resources, 9.9 dentists per 10,000 population, so it's the highest in Europe. And our research also indicate that dentists use very modern technologies and they have very modern equipment, and so it is a very big contrast between the staff, a very good educated and equipped staff, and the health outcomes. It's also important to highlight that this high level of job satisfaction among respondents was in the context of extremely critical assessment of the dental care system in Poland, because almost 75% of respondents assessed the system as a very poorly organized, and particularly they reported the huge underfunding of the public sector, of course, instability, still new reforms, and regulatory turmoil, bureaucracy, of course, and lack of planned long-term health policy. So in this context, we are really impressed that we could notice so high level of job satisfaction among this group of dentists. So going to the conclusion, our results indicated that most of dentists that participated in the survey were satisfied with their work, because more than 90% of respondents reported rather high level of job satisfaction. And our research confirmed strong relation between job satisfaction among dentists and age, sex, women, working hours. Dentists who work longer are more satisfied, location of the office, and working for public or private sector. And we of course, higher professional satisfaction we observed among younger doctors. As I said before, working longer and working for private sector, and of course, as I mentioned before, in large cities more. Women reported higher job satisfaction than men, and we didn't observe significant statistical relation between income and job satisfaction. And we also didn't observe the relation between instability in dental sector. This situation in the country, in the health system, has no impact, fortunately, no impact on job satisfaction among dentists. And of course, there are many limitations of our research. Comparing to other very similar research from other European or let's say high developed countries, because some working conditions, I mean especially the difference between private and public sector, and of course the other elements, well, specialization, possibility, well, of access to specialization, and many other elements of environment they are different in different countries. The other question is applied methodology of research, which is also, well, different in different studies. And of course, the research are done at different cohorts of dentists. So, of course, we know that the results of our research cannot be generalized. Well, that's all. Thank you very much.
Joanna, thank you so much. This was so interesting. I'd like to ask a couple of questions. One
Yeah.
of them is, what are you thinking about doing next after, you've gathered this, investigated this study? What would you like to do next for a study? And I think you mentioned that this was part of other studies that you've done, but if you had the opportunity to conduct another study, what would you like to do next?
Well, I think that each country, well, I'm researcher in I'm dentist, but I'm researcher in public health. So, well, we take into consideration different topics, and I think that each country have their health success of a policy, and some big problems. And I don't know exactly, but well, in your country, in the United States, well, for us, a big success of American public health policy, let's say public health policy, is all legal campaign with smoking, that so small group of people smoke in the United States, and you were precursor of limitation of smoking, and I think that it is a big success. And we in Europe, in European countries, we still follow us for many years. And comparing smokers in States and in European countries, there is a still big difference. Still too many people smoke in Europe. So it's your success. And your big problem is, I think, obesity. Well, I don't know if you agree with me. In Poland, we have a similar situation. In some policies, we have a big success. We have one of the biggest decrease in cardiovascular mortalities, for instance, over past 30 years. On the other side, on the other hand, we have one of the biggest caries index among children and adolescents. The caries index in Poland is higher than in many poorer countries, like in, for instance, Ukraine, Russia, Federation, etc. So, well, we have really now, I think, it is a shame of our health policy that we have one of the worst situation with caries and periodontal diseases among high developed countries, especially in Europe. So we still try to, speak with politicians. We do such research to provide them, some evidence. To provide them evidence that they must do something, because, well, it's the role of researcher to provide evidence to politicians and for public, of course. So now when we did this project, well, we present our results, everywhere, or conferences, meetings, and, well, where is it possible? Well, and we hope that it will result in 10, 20 years. Well, now we don't think about continuation. We think more to popularize, to disseminate these results, and to mobilize public.
That makes sense. And, thank you for this background. I'm wondering, with this dissemination that you're talking about, have you reached out to the media? Now, it sounds like the politicians and other researchers and perhaps everyday people could be reached better through the media. And I don't know the media in Poland, but I'm wondering if that would be another group that could disseminate widely your research. Obviously, it would require knowledge translation so that everyday people understand it. So has that been a group that you've reached out to?
Well, yes, it's a big problem you mentioned, because we researcher, we are very close, and we discuss in very often on our scientific conferences, and nobody listened to it, maybe. Well, I of course I exaggerate that nobody, but well, it's maybe too complicated for politicians, because a few years ago I organized a workshop, and I invited about the relation between policy and health outcomes. And because we wanted to show politicians the relation that all decisions, all political decisions in different areas, not only in health system, but in transport, in communication, in environment policy, etc., have a result in health outcomes. And we were speaking among researchers about Lalonde and all this relation, and these politicians, and we invited a big group of local politicians, and let's say decision makers, maybe. And for them it was completely new. They did nothing about this relation, and they were shocked after and this group of makers were responsible for many important, strategies implemented in our region. And they said to us, oh, we didn't know there are some relation between socioeconomic factors and health. Oh, we didn't know it. Oh, there are some relation between transport policy and health. Oh, we are really shocked. Oh, you know, um, it is very important what you mentioned, to contact with public and how to contact, because we, for instance, our group, we did a project, few years, some money, we did we published few papers, but to tell the truth, yeah, I think it's not enough attention from politicians.
No, I agree. And I'm thinking, the media, when I meant the media, I meant radio, TV, newspapers, and social media. And I don't know if social media is a way of reaching politicians like it is in the United States. We know, as you probably know, many of the politicians now use Twitter. But that would be a simple mechanism to get your message out. And a lot of times, messages have to be heard multiple times before someone really acknowledges that they understand what it is. That's why we see commercials, the same commercials over and over again for different products. So that would be, a suggestion for the future. Any last thoughts before we conclude this interesting webinar?
Well, I think that, thank you very much. I think that it is a very good idea, very interesting, because, and it is, this webinar is for me also kind of your recommendation to contact with people using social media, of course, because, we published many papers, and nobody presented such an initiative like you with webinars. Well, I think it's also a very interesting form of to mobilize people, to convince them to send some information. Well, so for me it was very, very, very interesting initiative. I haven't heard about such an initiative in European magazines, so maybe I can suggest something like that. We have a European Journal of Public Health, and the European Public Health Association, so I must suggest them maybe to organize such a forum.
Yes, and what I'm finding is that it allows scientific materials to be accessed globally. If someone has access to the internet, they can easily go online and live, listen to or participate in the webinar. But we have a YouTube channel called Learn at Work, and once we have your webinar posted, I'll send it to you so that you can share it with others. But it is, I think, a viable mechanism to get knowledge out, to advance the science that people are doing, and to help other people, politicians, like you mentioned, understand what the issues are. So I want to thank you so much for spending time with us today. And I look forward to more publications, submissions of publications to our journal work. And everyone, thank you so very much for being here with us.
Thank you, Karen. Thank you very much. Because, well, as you said, only small group of people, small group of experts, particular researchers, maybe will read or use this paper. And if we do such a popularization, short and easy popularization like webinar or other forms, yes, we will save our results, because well, after some times nobody will remember well, such results, even if they are, you know, very, very, very special. But well, nowadays world goes so quickly that, well, each day we have new results.
Yes, and I'm so glad that you agreed to do this webinar, because now this will be here for many people to listen to. So thank you so much.
Thank you.